The purposes of introducing our next witness.
Thank you, Madam Chair, and I'm pleased to introduce James Eckstein, who's the president of Eckstein Roofing, Inc., which is located in Cincinnati, Ohio. Mr. Eckstein has been working for the company since 1975 and has served as president since 2002. His business has been providing the greater Cincinnati area with residential and commercial roofing services since 1945. Eckstein Roofing is a second-generation family-owned company with a third generation actively involved in the day-to-day operations. The company currently employs 35 people, so the epitome of small business that we're trying to encourage in this country. Mr. Eckstein also currently serves as vice president of the National Roofing Contractors Association, one of the nation's oldest trade associations, which is based in Rosemont, Illinois. And I would note that he's come at considerable sacrifice because, as some may know, Hurricane Ike, at least the remnants of it, came roaring through our area, Cincinnati, Ohio, and knocked down innumerable trees and many people. In fact, over 90% of the people in the greater Cincinnati area were without power. Some are still without power. Our home was out for about a day and a half. My wife called me and told me that she had it back on, but you know, reading by candlelight and that sort of thing, which was unusual, but what we went through clearly wasn't as severe as what many others went through in other parts of the country that were more seriously impacted. But he came back from being out of the country and came to Cincinnati, I understand, to see this, and so he had some challenges coming up here. And I also might note that there were thousands and thousands of homes that had shingles ripped off the roofs, and so I know there's considerable work to do here. So we appreciate his coming here to share testimony that might be valuable relative to health care for small businesses. And so I'll quit talking and start listening, Mr. Eckstein.
Okay.
Thank you.
Thank you, Madam Chairwoman, Ranking Member Shabbat, and members of the committee for the opportunity to discuss health care reform for small businesses. My name is Jim Eckstein. I'm president of Eckstein Roofing Incorporated in Cincinnati. I also serve as a vice president of the National Roofing Contractors Association, and I'm testifying before the committee on behalf of NRCA. First, I want to commend Chairwoman Velasquez and Congressman Shabbat for your outstanding leadership on health care and other issues of importance to small business. Your tireless efforts on behalf of working Americans are greatly appreciated by NRCA. NRCA welcomes the opportunity to testify on the problem of excessive increases in the cost of health insurance for small businesses, which has been a major concern for roofing contractors for many years. NRCA strongly supports the Small Business Choice Act of 2008 because we believe it will address this critical issue. We commend you, Madam Chairwoman, as well as Congressman Joseph Pitts for recently introducing this legislation. NRCA also commends Congressman Shabbat for introducing the Health Insurance Affordability Act of 2007, which would allow individual taxpayers to take a tax deduction for their health insurance costs. At Eckstein Roofing, we believe it's very important to provide our employees with high-quality health care benefits, and we have done so for many years. Moreover, it is necessary that we do so in order to remain competitive in attracting and retaining high-quality employees. However, providing health coverage for our employees is becoming more difficult each year as we continue to be hit with double-digit premium increases. Our most severe problem now is that insurance companies are unwilling to provide us with competitive pricing because of cancer and other health conditions among a few of our spouses and families. As a result, we have no choice but to accept the double-digit premium increases from our current insurer. The excessive premium increases charged by our insurance company year after year have forced us to increase the amount that our employees pay for health care benefits, which I greatly regret. In addition to jeopardizing the health of many workers, lack of affordable health insurance also greatly hinders economic growth across the nation. Small entrepreneurs are the primary source of job growth in our economy, and difficulties in providing affordable health benefits to employees slow their ability to grow their business and create new jobs. Moreover, the current manner in which health insurance is regulated puts small business at a disadvantage to large corporations in providing health benefits to our employees. It is clear from the situation at our company that some form of expanded pooling is necessary in order to spread risk across greater numbers of insured lives. Expanded risk pooling is essential if we are ever going to restrain the excessive costs of health insurance for small businesses. NRCA strongly supports the Small Business Choice Act as one method of expanding health insurance pooling opportunities for small businesses. The Choice Act is a private sector solution that creates new purchasing cooperatives designed to allow small businesses to stabilize health insurance costs by pooling risks. The bill also provides a tax credit to small employers who purchase health insurance for their employees through a cooperative. Finally, the bill provides a role for trade associations like NRCA to be involved in the development of purchasing cooperatives. We believe that the establishment of new pooling options for small businesses, such as the cooperatives envisioned by the Choice Act, will inject greater levels of competition into the health insurance market. The need for increased competition in health insurance markets is widely agreed upon as a key ingredient to help restrain the excessive cost of insurance. NRCA is committed to working with Congress to obtain enactment of the Choice Act and possibly other bipartisan proposals that address the problems small businesses face obtaining access to affordable health insurance. NRCA strongly urges Congress to take up small business health reform early next year to address this urgent issue. Again, thank you for the opportunity to share NRCA's views, and I would be pleased to answer any questions you may have.